a world where data science holds the key to addressing humanity's most challenging issues, the Data Science Without Borders DSWB initiative has emerged as a bridge across Africa and beyond, linking countries to opportunities that would help governments harness the power of data for positive change.
Data Science Without Borders, starting from its name, is a very interesting project. I'm the lead with a couple of colleagues from very many partnering institutions. It's a dream that we wanted to see data science spread across Africa. We always know that Africa has been known to lag behind the Industrial Revolution, but with the advent of AI and data science, we wanted a project that will bring partners in the African continent. We'll look at institutions coming together to start to harness the power of this new technology, to leverage their data sets, and to build capacity in data science and AI to help Africa realize its dreams through data.
Launched in February 2024, DSWB continues to empower African scientists to champion data-driven solutions. By breaking barriers and strengthening systems, DSWB is driving innovation and creating lasting impact across Africa.
The Data Science Without Borders project had three main objectives. The first one is to strengthen data systems across partner institutions in Africa. Then the second one is to create a sustainable environment for collaboration, reproducible research. Lastly is to build a no-code platform for the application of data science tools by researchers and also data scientists.
The journey through Addis Ababa, Dakar, Douala, and Nairobi has been inspiring. In all the four cities, DSWB has sparked innovation, nurtured collaboration, and empowered learning.
The DSWB program has been a great opportunity for us. We have been able to develop successful partnership with several types of organizations in country. This includes the university, such as the Cheikh Anta Diop University, the Faculty of Science, the Faculty of Medicine and Pharmacy, hospitals, the Military Hospital of Wellcome, research institutions such as the Senegalese Society for HPV and HPV-related cancers, the Ministry of Health, the Department of Maternal and Child Health, the Department of Research and Innovation, which is a key department for research and innovation within the Ministry of Health. They are all on board with us.
At the APHRC Pathfinder site, we were able to achieve some significant milestones. For example, we are able to form partnership or collaboration with different local partners, including health and demographic sites, universities, and basically health offices, regional health offices under the Ministry of Health. So making collaborations, we were able to sign agreements with these partners. So we consider this as really a success, because we are going to work with these partners to access different kinds of health data and also build capacity in the government health system.
We are working on the one hospital, which is the biggest hospital that we have in Douala, even in Cameroon. So we decided to carry out one study here, the desk review, to identify the critical gaps that we have here in terms of data management. So the result of this study was presented during one meeting where we invited the different heads of the department that are working here in the hospital. So we also have in our team some master and PhD students coming from the different universities in Cameroon. So they are working with us under this project, and we will continue involving some external stakeholders in the project. So we will present them our project, and then we intend to train their different data managers so that they can reinforce their capacity in terms of data management, machine learning, and artificial intelligence.
DSWB has helped participants gain valuable skills in data analysis, machine learning, and tools like Observational Medical Outcomes Partnership, OMOP. They have also strengthened their soft skills such as teamwork, leadership, and problem solving. The project is not just about building skills, but also confidence, inspiring innovation for Africa's future.
DSWB project has made my profession grow in a lot of ways that I can't even mention all. But the main thing is that as a data scientist, being able to work with a lot of people around the world who work on the same thing and being able to gain a lot of skills from them, data analysis skills, data management, storing, quality checks, a lot of things that I can mention. But just aside from working on the data, the multiple other skills that I have gained is communication skills that have helped me communicate with multiple people, and I have also learned a lot of languages since we work with multiple people with new skills every day, and I think that has helped me grow as a data scientist.
Et Data Science Without Border m'a donné la possibilité de continuer avec un PhD en santé publique appliquée à la data science. Oui, ça c'est l'une des opportunités parmi tant d'autres qu'il m'offre. En plus de cela, je peux citer des opportunités telles que les collaborations avec des experts internationaux dans le domaine de la data science. Et tout ceci pourra nous aider, pourra m'aider principalement à renforcer la data science dans le secteur de la santé en Afrique généralement, mais plus précisément au Cameroun.
Beyond their skills and their data, the DSWB project has created a close-knit community of practice.
The first year was really about setting it up, building systems, but also at the same time we had a scope that we had to accomplish. The first challenge was really around coordination. We have teams in multiple countries. Each of them are different institutions, they have their own systems, their own ways of working. So how do you bring these people together to fulfill one common goal, which is the project, to make sure that you're getting your goals done?
Les défis majeurs qu'on a eu dès le début, c'était surtout au niveau de l'approche, parce que quand on parle des outils de la data science avec une application de l'intelligence artificielle, les gens sont beaucoup plus, sont un peu méfiants quand même. Et voilà, dès le début, nous avions rencontré ces défis-là avec l'approche au niveau des partenaires locaux. Mais nous sommes parvenus à vraiment poser le débat, expliquer l'intérêt du projet, que c'est vraiment l'un des objectifs majeurs, c'est le renforcement des institutions africaines de santé, mais aussi de pouvoir réellement créer un environnement de collaboration pour renforcer l'écosystème au niveau du Sénégal. Et pour cela, tous ont adhéré à la cause de ce projet, qui est vraiment de renforcer les capacités. Et nous avons eu aussi des retours par rapport à leurs besoins. Ils ont eu, voilà, chacun a fait des évaluations, surtout au niveau matériel, les infrastructures pour l'hébergement des données, le stockage, la gestion des données.
I remember that when we were organizing the Pathfinder visit in Douala General Hospital, we had to manage a tough schedule. On the first day of the visit, since we were having participants from many countries like Ethiopia, Uganda and Kenya flying to Cameroon, the first day we were supposed to launch the project and also organize an EPU. In French we call it Enseignement Post-Universitaire, where one of the key speaker was Agnès Kiraga, who was supposed to discuss with interns in the hospital and also students about data science. So on the same day, and those two events were happening in two different places. So we had to manage the schedule in order to make sure that we were on time on both sides.
So DSWB is one of many projects that APHRC supports, of course with partners and funders support, to generate evidence. We actually want to transform lives. As data scientists, we want to transform lives through the use of data. So in DSWB, APHRC has been at the forefront. We are the leading institution for DSWB. And through this, we have created very many systems that are going to make this project successful. We are good at collaboration, grantsmanship, capacity building. We have a team of researchers who are always by our sides as data people to, bring the research questions that speak to the continent, bring the research questions that speak to the countries where the project is being done. We have a training team. We have a team of data scientists, and strong financial systems. In all these structures, APHRC is really at the forefront and ensuring that we do the project well.
As the Data Science Without Borders project completes its first year, we look ahead to expanding its reach and impact, building a new generation of data scientists equipped to address Africa's challenges.
In terms of what's next, we want to see an Africa that is working around data-driven solutions, our own solutions. And through DSWB, the hope is, what we envision is that we have an impact in terms of, one, capacity building. We want to build a group of skilled African data scientists who can work with policymakers and other decision makers to use data to make better decisions, whether it's whichever sector, health, agriculture, education, but we are using the data, we are using evidence to make decisions.
I hope for the future of DSWB, Data Science Without Borders, it will continue to create a network of data scientists in Ethiopia and in the continent, and this will transform the capacity of the country and the healthcare system to use data by applying the current and advanced data science technologies and approach, including machine learning, AI, and the rest.
I hope to see more partnerships between local organizations, academic institutions, and also international data scientists to share knowledge and resources. And also, I envision that this program will provide hands-on training and mentorship for aspiring data scientists in Senegal, helping to build a strong local talent pool. And also, I hope the program will create lasting change by equipping individuals and organizations with the skills to continue using data science for social good long after this project ends.
This project will bring a lot. It will help us in how to collect data from the patient, how to manage them, how to uniformize them, and then how to analyze them properly. So that's something that we hope from the project. And the project has also come in a context that the management of the hospital is working to put in place a digital information system. So we are working with a consultant on the EMR system in the hospital, and the situation analysis that we have done in DSWB project gave us a lot of information that will be useful for the consultant working on the EMR system.
My biggest takeaway is building the ecosystem in Senegal for AI and AI-related tools, the use of AI-related tools to answer our own research questions and drive innovation in country, not only during the lifetime of the DSWB, but beyond. This is really the major and the biggest takeaway that we will have through this program.
Through collaboration and innovation, DSWB is more than a project. It's a movement, redefining healthcare and harnessing the power of data for lasting change.
Many times it's been said Africa needs to leapfrog. Yes, we need to leapfrog. We need to catch up with AI. We shouldn't be left behind, but we need to fix the processes that will get us there. Look for the data. Where is it? Is it in good quality? Do we have the people who are going to mine this data, analyze the data? Do they have the skill sets? Do we have the infrastructure to actually do the analysis and punch all these analyses out there? And of course, the governance. You know that Africa has a lot of data governance, diversity. How do we get to that point? How do we learn from the different countries? And once we fix these important pillars, even as we leapfrog, it will be the success for effective use of data science and AI in Africa.
The journey of Data Science Without Borders has only just begun. With passion, commitment, and collaboration, we can continue building a future where borders do not limit progress and where data science empowers us all.